Hi. A few weeks before, I have asked you to send me questions on the neurophysiotherapy approaches. A lot of questions I have received, so this would be the series of videos in which I'll be responding to each question. In this video, I first wanted to give a brief description or understanding of what neurophysiotherapy approaches are. I think if we go from that background, from that understanding, it might be easier for all of us to, you know, get why certain questions are arising, why certain confusions are commonly surrounding this neurophysiotherapy approaches. The most common question is why we shouldn't use these approaches today, or is one approach is superior to another? That is Bobat is better than, say, for example, PNF or Roots approach, and so on, right? So, so this is what I'm going to do. I'm going to briefly describe what these approaches are. Um, these approaches, especially neurophysiotherapy approaches, are basically, in experts' view, in experts' beliefs about what is the right way to manage patients with neurological conditions. Now, why I put that as an expert's view is that it's important to learn or understand neurophysiotherapy approaches from the prism of time in which it is developed, and also from the prism or from the eyes of the proponent of a particular approach. Uh, if you look at most of these approaches are developed in 1950s, like I said, these approaches are basically expert views and beliefs on what are the patient's problem, why patients are unable to perform their functions, and what can we do. These are all about all of these things. Different approaches, different proponents of approaches have had their own views about it. Now, their views and beliefs, it's not just that came to their mind, but it is influenced or it is shaped by the knowledge that was available at that point of time. Knowledge about how brain functions, knowledge about how movements are controlled, and so on and so forth, right? But the problem of its relevance today, now we are asking whether these approaches, why can't we practice these approaches today, is that the knowledge that we have had at that point of time in 1950s about how nervous system functions, right, or how movements are controlled, is very rudimentary at that point of time. In the early 20th century is the time where we started understanding what is inside the brain, especially with the pioneering works of Sir Charles Sherrington, Thomas Brown, and many others who all have looked into and understood how synapses work, how information from the brain is communicated to other parts of the nervous system, to the muscles. That's when we started understanding. So many physiotherapists, rightly so, right, they try to apply that newer knowledge directly into their understanding of what patients' problems are. But what uh, they did was from the physiology to understanding of the patient's problem, or why the patient have a particular abnormal movement pattern and so on. They have used lots of their clinical observation skills and clinical intuition, and they have mixed it up with what they know, and they have interpolated to their clinical observation with a lot of conviction. Of course, typically clinicians have a lot of conviction about the treatment they give, and then started explaining this is why the problem is, this is how the treatment should be done, and so on, right? So this is how actually these neurophysiotherapy approaches, most of the approaches have developed in different parts of the world. You have in UK Bobat, in US you had Brunstrom, and so on and so forth. And this is also nothing unusual. Most of the medical interventions are developed based upon that. But one problem is that once our understanding of the disease, understanding of functions of body and nervous system changes, many of the previous knowledge that we have had about how a disease should be managed, it has changed drastically. I'll give you one example. If you take many diseases in medieval times, right? People thought that a person becomes ill because a evil spirit has entered into their body. Now, this is in medieval times where there is no scientific development, so people have just guessed it based upon prevalence of ideas of how now our human body functions. They have come up with the idea that there's an evil spirit has entered the body. So, what was the treatment for that? Is they put hole in the skull. You would see a lot of, even if you see, this method is called trepanation, right? You could just Google it and see in ancient Egypt and mummies, what they found a hole in the skull. A lot of skull had a hole because and putting a hole in the skull the idea is that through that hole the evil spirit goes out and the person becomes better. This is the treatment based upon knowledge in the medieval times. Even as late as in 19th century, if you take conditions such as tuberculosis, people thought that it is due to a vampire has possessed a person, and that's why suddenly a person is losing his weight and become lean and become like a skeleton. And naturally, the treatment is getting rid of the vampire with some religious ceremonies and so on. So the treatment that one medical treatment was always developed based upon what was the ideas that is prevalent at that time. That's why I said that neurophysiotherapy approaches should be viewed from the prism of its time and the knowledge base the proponents have had. Now, if you're asking question now, today in 2020, like 70 years later, we are in 21st century, we understand nervous system functions far better now. Whether these methods are still valid? Can it be? Right? These are all the question that we are going to address in the series of videos. I'll also explain how our knowledge has changed in terms of nervous system function and how or why many of the understanding which has formed the base of these approaches have become irrelevant today. Like there are lots of examples how each approach has viewed spasticity and what is the how each approach has viewed the relevance of sensory input, because if you see most of the approaches use sensory input as a primary method by which you can reach brain and do and control it and manipulate it to bring out the better movement and so on, right? So in the coming weeks, I'll be releasing, recording more videos at each question people have asked, and I'll be responding so. And if you're having questions on your own, please type in the comments section, either in YouTube or Facebook. I will respond to them. And also give me your feedback about this video. Right. So that's all. See you again next video.